Good afternoon. My name is Erin Colburn. I'm the Pre-Health Advising Coordinator for the College of Health Sciences here at Boise State University, and it's with pleasure I'm introducing Joni Loftin from Idaho State University in the School of Rehabilitation and Communication Sciences to talk a little bit about audiology, speech language pathology, and sign language and interpreting.
Thanks for having me. So yes, I've been at Idaho State University this is my 31st year. I was on the Pocatello campus for 26 and came to Meridian in 2016. So I am Associate Chair for Communication Sciences and Disorders based on the Meridian campus. And my profession is speech language pathology. So what I want to share with you today primarily is an overview of the programs, the degrees that we offer, sort of what those provide you in terms of a career and those kinds of things. So in our department, which is Communication Sciences and Disorders, we train audiologists, speech language pathologists, and we have some degrees in sign language and in interpreting. So this address here in red is the one to write down, because that's where you're going to find all information. You're going to be able to find information about all these programs, how to apply, who to contact with questions, and so on and so forth. So this slide as well gives a lot of different contact information. But again, if you go to the one that I just mentioned, you're going to be able to access anything about our department, and again, who to contact, and both campuses. The other thing you should know is that Allie Crane here in the middle is the advisor for junior transfers and for what we call pre-professional students, which those are people who already have a bachelor's degree in something else and they want to come do speech language pathology or audiology. So Allie is sort of the go-to person in terms of advising, but certainly if you contact the department in general, we can hook you up with whoever you need in terms of your question. Here's our specific program. So in speech language pathology, we have a BS in what's called pre-speech language pathology or pre-audiology. Why the pre? Because to practice as a speech language pathologist or audiologist, you need advanced degrees. You need a master's degree for speech pathology, and you need a doctorate, and what's called a clinical doctorate, an AUD in audiology. And so in terms of the pre-degrees, if you got those and decided you didn't want to continue in speech pathology or audiology, you could utilize those to become an assistant or aide in various settings. Audiology particularly is more varied. Speech pathology aides and assistants are mostly used in school systems. So what you would do is you would work with kids under the supervision of the speech language pathologist who has a master's degree. And then in sign language, we have the associate's degree in sign language studies, and then the BS is in the sign language interpreting. And we have quite the impressive faculty in sign language interpreting, including a deaf faculty member. And they work with you, the students, to not only be sort of a generalist in sign interpreting, but they also offer you some tracks relative to being a specialist in a medical setting, let's say, or in a legal setting. Because as you could imagine, there's different vocabulary and different sort of nuances in terms of what an interpreter would need to help the client who needs the interpreting. Okay. So let's start with speech language pathology. What do we do on a daily basis? Well, we assess speech language disorders and we treat them, right? Provide therapy. But other things that we do is we have consultation with family members. We have consultations with other professionals. We do coaching. You know, if we're working with little kids, we might coach the parent on how to work with that child more than, me coming to their house once a week and providing therapy. That's not going to get the child better. So it's really the parent that needs to be, interacting with the child. We have meetings just like any profession. We write reports, we write daily notes. You might complete billing or billing paperwork. And then of course, in my position in the university, we've got, teaching students or administration. So what does an audiologist do? Let's talk about this because it really goes beyond hearing, right? So they do diagnose hearing, but you might not understand that your balance system, a lot of that is in your middle ear, your inner ear, actually. And so they work with people who have balance issues. They conduct newborn screenings. All babies in Idaho are required to have their hearing checked. They sell hearing aids if they're trained in that. They troubleshoot hearing aids. So sometimes someone may just be coming in for, hey, these aids aren't doing what they were doing. And then, so they troubleshoot them and they work with all these little tools. So maybe that's something that you have interest in. They, of course, help people habilitate their hearing to the best level possible. They work in school settings, medical settings, environmental work settings. So they might consult with industry, right? There's safety measures in place for people to preserve their hearing. And so certain noise levels, we know, damage hearing. And so there's rules in different work settings that need to be followed. An audiologist might be an industrial audiologist and go in and measure different things that are going on and then give them ways to mitigate some of those things and how to continue to measure it and make sure that everybody's safe. They do some of the same things as speech language pathologists. If you're working with people, you have them as a patient or a client, you have paperwork, you write, reports, you write notes, you submit billing paperwork, those kinds of things. I think I got most of those. So let's just talk about some labor statistics here. These are the most recent statistics that are available. They're always behind, right? So in 2019, the median pay for a speech language pathologist was a little over $79,000 a year, which equates to a little over $38 an hour. Again, you have to have a master's degree to practice, okay? But the really amazing news is how there's all of our grads get jobs. And literally this field has been in demand since before I graduated from my undergraduate, 35, 40 years ago. So we continue to be in demand because we continue to learn different things about how we can serve different populations. And so it continues, and our population's growing. And so it continues to be in demand. So the number of jobs across the country, US, in 19 was over 162,000. The outlook for the next 10 years, that should say 2019 to 2024. So I don't know how I did that mess. So anyway, the job outlook is that it's going to grow 25%, so much faster than the average of all other professions over the next 10 years, okay? In terms of audiologists, their median pay was $77,600 with a per hour equivalent of about $37. They need a doctoral degree, and that is a clinical doctorate. That's a 4-year degree. So they need a bachelor's degree in something, and then they need the 4-year audiology degree. The number of jobs in 2019 in our country was 13,800, and the predicted growth over the next 10 years is 13% increase. Audiology was named, I think it was maybe 2 years ago, was named one of the most, what was the wording? I want to say like least stressful jobs. Like people really reported that it wasn't stressful and that it was, they really enjoyed their job and really found it to bring them joy in providing people that help. So as I raised 2 daughters, and they just kept thinking my job was boring, right? Like, no, that sounds so boring. Mom, you just look at people and you go, say this. Well, not really. That's a little simplified, very simplified version of what we do. So this is really the only thing that they think that we do is get into people's face and basically say to the person, say what I say. Well, think about this. If I could literally have a child in front of me who has a speech problem and go, say what I say, and they could do it, they wouldn't need therapy. So you can imagine that it takes much more than that. So it's really not boring at all. And I can assure you that every child, if I had 10 kids in here who can't say the S sound, I would need to work with them in 10 different ways, because they're 10 different kids who bring 10 different, lives to me in terms of their development, in terms of their home life, in terms of their medical situation, and just why they're having troubles with S. So I just wanted to give you a little bit better picture of what we work on. We work from babies to geriatric, okay? It's not, speech pathologists are trained to work with that entire population. It's not super common for people to work with all of them at once. So it makes it nice that you have that variation across your career to do different things. So just a few milestones in terms of what are things that we work on in that. Well, believe it or not, before a child says their first word, they have to learn very specific types of prerequisite skills. And so, yes, you work with babies or toddlers who aren't talking before they say their first word, if they're not doing a lot of prerequisite kinds of things before they talk. Okay, and so we help them speak their first word. We help kids, of course, produce sounds correctly. And then once they're producing words, some of them need help putting the words together. Maybe their speech is perfect, but their grammar is what you might know. We call it syntax, is not developed right. They're missing tense markers or whatever. They don't know how to formulate questions. Maybe they don't know how to use social rules. You might not realize how many rules you are incorporating every day when you talk to someone, right? You talk differently to your instructor than you do to your friend, right? There's rules about how far we should be from each other. There's rules about turn taking and not interrupting. There's rules about when you say a question, your voice goes up at the end, right? Is that the one you like? That's a question. That's a social rule. Kids need help with vocabulary. And then we have kids and adults who have accidents and maybe they have a brain injury. So we need to retrain them how to speak, retrain them how to retrieve words from their brain, retrain them how to put words back together, retrain them how to function communicatively in their job setting, those kinds of things. Or an illness could also cause problems like multiple sclerosis or Parkinson's disease. Those kinds of things can cause speech issues or swallowing issues, and we deal with that. Here's the areas that we specialize in, right? It's not just about speech. It's not just about language. It's about those plus stuttering, swallowing, what's called augmentative and alternative communication. That can be anything from sign language to sophisticated computer systems where someone, for some reason or another, cannot speak with their voice. They might be able to make sounds, but they cannot produce speech as a means of communication. And so they communicate another way. Voice disorders like vocal abuse or the wrong pitch, okay? Feeding disorders, we have kids who just struggle with going from liquids to solids, autism, and all of the different language and cognitive things we can work with, neurological disorders, like I mentioned, the brain injury. We help stroke patients come back from their brain injury from the stroke. Orofacial myofunctional disorders. Those are disorders where people are not correctly utilizing their muscles of their face, so their tongue, lips, jaw, teeth, they're not using them correctly. And so they might do things like thrust their tongue in their swallow. They might resort to things like thumb sucking that we've got to get rid of, or they might have a tongue tie, and on and on. We work with people who don't speak English as their primary language. And so that might involve helping them with the language, or it might be involved with just helping them with their speech so that their accent doesn't interfere significantly with people being able to understand them. We work with deaf and hard of hearing individuals with cochlear implants. This man here has a specific device that helps him speak because he had laryngeal cancer and his larynx, which is where our vocal cords are, had to be taken out. So he's using something that provides the vibration that normally the vocal cords provide. So he's learning to use that. So these are more what speech therapy looks like, speech language pathology work looks like. Augmentative communication on the top, teaching language and communication. The middle one is a swallow. The bottom one's looking at potentially vocal abuse that needs to be addressed. And there's the medical setting where they're viewing their actual folds. So where do we work? Again, we're so lucky that we have not only the opportunity to work with babies through adults and everything in between, and maybe I work with kids right in the middle, and I specialize in autism versus something else, that we also have a variety of settings that we can choose. We might work for a home health agency or a state agency where we go into their homes, a school, a hospital where patients come in, or hospital where we work with the patients while they're in the hospital, short-term or long-term care facilities, specialized care facilities like memory units for people with dementia or Alzheimer's, private practice where there's just a span of anything, any disorder, a federal agency like the VA hospital where you work with vets. Again, there's home health agencies, or in my position, a college or a university setting. So you might teach people who are learning to be speech language pathologists. How about audiology? Here's their areas of specialization. So while, again, in both of these areas, when you're in school, you're trained to be a generalist. So you know enough about all of these that you could choose your job. And then when you get into your work setting, you might only focus on 2 or 3 of these things and sort of become a specialist there. And then if you decide, this was fun, but I really need to change, you can go to another setting and specialize in something else, and you don't have to go back to school. Now, you might need to bone up by going to like a workshop or something, but you don't have to go back to school for another degree. And essentially, you practically have a whole new career. So this is audiology's specialty list. They work with people who have cochlear implants, like this top picture here. Hearing aid fitting might be their deal. Working with pediatrics versus adults or vice versa. Just think about working with a geriatric person is very different than working with a child. So in terms of lots of different reasons, not just their age and, how to how to test someone who's young versus how to test someone who's old, but all the different things that maybe medications that an older person is taking for various sort of common elderly issues. You have to consider that in treating them in audiology. Environmental noise, which I talked about earlier. Balance disorders is a very specialized area. Educational audiology, which is where you work in the schools, and you deal specifically with kids who are trying to use hearing to learn, right? And so they look at very different kinds of problems that a child has than if they're just looking to see, do you have a hearing loss in my audiology clinic? It's very different to take that educational view of what we can do in the setting for this person. Intraoperative monitoring. So that's for someone who goes into a medical setting and is involved in whatever way an audiologist is involved in terms of the cochlear implant surgery and other surgeries. And auditory processing disorders. So here's what's, again, just a chart that we've really talked about. One of the things I want to point out in the middle here, it says that you have to have a minimum GPA for your undergraduate. So if you go into the pre-speech or this pre-audiology program, it's very competitive to get into graduate school. And so the minimum to be considered is 3.0. But I have to tell you that you really need to strive for a 3.5 or 3.4 or 3.5 as your minimum to actually be competitive. Okay. So that's something that we're considering even changing in our, written policies so that people really understand, yeah, you can apply if you have a 3.0, but you're not really going to be competitive for the programs across the country, really, not just our program, for if you don't have a 3.4 or 3.5. By the way, so audiology, I should check. I don't know how many seats they have in their program, like less than 10. They have small, once you get into the doctoral level, you don't carry large classes. The SLP program, we have about 50, 25, we have about 55 slots. We have so many on our Meridian campus. I'm talking about the master's degree now. So many on the Meridian campus, same amount on the Pocatello campus, and a little bit larger number for online. We offer an online master's program that's part-time. Okay. So then we have what's called a pre-pro. So if you get on our website and you see pre-professional program or leveling program, that's for people who have an undergraduate degree in something else, absolutely anything, 10 years old even, right? So if they have a bachelor's degree and they are like, I want to be a speech pathologist or I want to be an audiologist, then they would take 1 year, you can go part-time if you want and make it 2, 1 year of what we call the pre-professional or leveling courses. And then once you take those, you can apply to grad school. You actually apply midway. So after your first semester, you apply for grad school, and then you're considered sort of caught up and can then enter the master's or clinical doctorate program from that pre-pro. So in just kind of thinking about what I've been saying relative to the variety of types of things that we do and the variety of types of disorders that we see, just imagine with these kinds of careers, first of all, training for a career that's in high demand. How important is that? Having a variety of work setting options to choose from. And again, not just when you start, but your entire career. Imagine changing from one professional focus to another without needing a degree, right? I have never, ever worked with aphasia clients, adults who have had strokes. I've never worked in a hospital. So for me to go do that, if I wanted to apply for a job there, I have the degree I need. I just, of course, would have to take some training on my own and what the hospital might want me to take to sort of bone up on that specific population. But it's essentially a whole different career for me. Imagine helping a 3-year-old say his first word. You'd be surprised how many 2- and 3-year-olds say nothing. They're supposed to talk when they're 1, at least a couple of words. Imagine providing a non-speaking child an alternative way to communicate their thoughts, their feelings, their needs. Imagine helping a stroke patient remember what and how to say his spouse's and child's names. Very often, they can't bring those words up after they have a stroke. Or how about reestablishing a normal swallow for a patient who underwent radiation treatment for cancer that hindered swallowing? As a matter of fact, we're receiving word through literature that we're going to have a huge increase in swallowing therapy needs because of COVID, because of all the intubations, right? So the intubations that have been in there so long that they've damaged that area. And so they're going to need help with swallowing. Just imagine helping modify an accent for a college student so she's better understood, or reducing the fear of stuttering for a teenager, right? That's what we help them do, is don't be afraid of your stuttering. Assisting a toddler in feeding skills that will improve weight gain and improve his mom's sanity. How about supporting an 8-year-old who received a cochlear implant? You could be there when they say, "Hi, Mom," for the first time. Help a throat cancer patient find his voice after his larynx is removed. Empower a parent to improve interaction and bonding with her child. Some parents just don't know how to play with their child. Imagine empowering them with knowing how to interact. Finding the right hearing aid for a new grandpa so he can hear his grandkids. Wouldn't that be cool? Showing an Army vet strategies for success as a classroom teacher after hearing loss from an explosion. So very exciting kinds of things that you can work on relative to becoming a speech language pathologist or audiologist. Now, in terms of sign language, I don't have as much information. And Lavona Andrew is the person to contact at ISU. So again, you can use that main CSD email address to figure out who to contact, or just contact someone and we can hook you up. But Lavona is the person to talk to. She's the director of this program. ISU just went to a new email formula, and it's basically our first and last name finally. So Lavona Andrew at isu.edu. Again, we have a BA in sign language, which is actually only offered on the Pocatello campus. And then the BS in sign language interpreting is either.
So with this program,
Yeah.
they have to do clinical time, correct?
Mm-hmm.
How do they do that?
Only, well, they don't in undergrad. In undergrad, they need to get 25 observation hours, but we guide them in doing that in the classes.
Okay.
Yeah.
And then as graduates, they need.
Then as graduates, they do the clinical. Mm-hmm.
How do they do that with the online program?
Well, they come to campus in the summer,
Mhm.
and then they do the rest of it where they live.
Oh, okay.
Mhm.
That's cool.
We have different agreements, like we have to have an agreement with whoever they do it with. We have these legal agreements, right? Students help set those up. Mm-hmm.
That is cool.
Yeah.
That is actually really cool.
In fact, a lot of online programs, speech and otherwise, don't ever see their students live, but we didn't want to put our name on students without seeing exactly what they're like with their clients. And so, yeah, they travel to Pocatello the first summer, regardless of where they are. To Meridian the second summer. They work with kids the one summer and then adults the second.
Wow. That's actually really cool.
Uh-huh.
I mean, not the semester in Pokey, but
Well, they get to go to Yellowstone. We take them around, let them visit.
okay. So okay. It's like you show them the good parts, right?
Yeah, for sure. And the other thing is they're there for 6 weeks and they are like 24/7 working. Like they are, so they don't even know, it wouldn't matter where they were.
Yeah. I want to be a speech language pathologist now.
Bring it on.
You know, every time I hear these things, I'm like, and I'm going to be a speech language pathologist, gerontologist.
Right.
I have a whole new.
I
He also
know.
likes occupational therapy too.
Yeah.
I don't blame you. They have a varied job too.
Yeah. So do you find that most of your students end up go like into clinical settings or schools, or where do they end up going? Because I know you said that's like almost 100% placement, job placement, right?
Yeah, there's 100% placement.
That is amazing.
Well, they go all over, honestly. I mean, they go into hospitals, private practices, and schools. I mean, those are the primary ones. I would say those are the bigger ones versus, we have a few students that would go like in a long-term care facility or short-term care facility, or a few, but like they less go into, what do you call it? Like state agency kinds of things. But the most of them, there's a lot of private practices in the Valley, a lot. And so there's a lot of jobs. And then the hospitals, there's a lot of hospitals, and jobs turnover. So schools here in the Treasure Valley don't have a hard time hiring people. It's the rural schools that are sort of scrambling.
Right. Well, I'm from Cambridge or Council, Idaho. I don't know if you know.
Oh, I know where Council is. I've never heard of Cambridge. Yeah.
Oh, it's like
right there, huh?
Yeah, it's right there. It's like 20 miles away, but like 500 people and stuff like that. And I don't think growing up they didn't have anything in the schools or in the area for like speech language pathology, stuff like that. They just kind of threw that job onto teachers without the training.
Right.
So
right.
Yeah.
I can imagine.
Yeah. How are they trying to do something about serving rural populations more, or is that?
Well, is this recorded? So,
So my question is, how many applicants do you have in a given year? And you had mentioned kind of competitiveness in the master's degree piece, but how many applicants do you usually have in a year?
yeah, so let me just cover the undergrad and the grad. So in terms of speech language pathology, undergrad wise, we do have an admissions process in Meridian. It's very simple, and we mostly have it because we only have so many seats to offer physically, like in our classroom. Other than that, you know, that's really the only reason we do it. And then the graduate program. So this year we had 600 applicants for our 55 seats. Now, not all of those ended up being qualified, right? Or so you can imagine, we're really only going to start with 3.4s and 3.5s, right? And that's like 400 of them. So that's where you get sort of left behind.
Do you guys interview for your master's degree program?
We don't right now, but we're considering that.
And you guys require the GRE for your master's program?
We do not. We stopped doing that this year.
Well, it was hard to get it.
Yeah, right. Well, and it's, you know, it's not deemed culturally sensitive either. And so most programs actually ended up dropping it. Idaho residents do get, so all the things that we require have certain weightings, and then you get these points, and then all the stats are run, and then you're in a list, right? And then what we do is we don't just go, oh, take them 1, 2, 3, 4. We don't do that. We go through them to see if there's any red flags that we found in an essay or a letter of recommendation or any of these other things. And then there's Idaho residents get an extra point, right? So they get a little bit of a bump. And of course, we always really want to look, where are our students and where do we, you know, where could they fit? Not that we let all of them in because they're not all competitive. But we do definitely want to make sure that we're not missing out on diversity and quality.
In terms of experience, knowing it's a pandemic and it's really, really tough, what would you suggest to a student in terms of gaining some understanding and experience in these fields? What would be a parallel idea to observation if it's not available to them?
So there's something called Master Clinician Network, and there is a fee. It's not very big, and I hesitate to guess, but I want to say like $25, but I hate to guess that. And what they can do is go on Master Clinician Network and do some observing of clinic there if they want to understand what therapy looks like. And then the ASHA.org, ASHA, American Speech Language and Hearing Association. That's our national professional organization. So that's who certifies us. So ASHA.org has lots of information, and I haven't been on there like lately to look at what's available for like students or people interested in the field. If they have videos and that kind of thing available, but they might. But even without COVID, things are tighter, rules are tighter, you know, in terms of being able to observe actual people in therapy. And then, of course, when they get into our program, we will guide them in the observations that they need to have through the classes that we offer. And I should back up too on that admissions question. So the last 2 years, we did not have 600 applicants. We had more like 300, 400, not that that's a small number, but we were pretty overwhelmed by the 600, which we used to have like 5 years ago, 4 years ago, we had 600, 700, 500, whatever. Then we sort of dropped down because that age group is, you know, there's low population for whatever reason. So you guys probably had heard that the college age population was available, traditional age was sort of dropping for a while here. There weren't as many people born, whatever years those were, 18 years ago, 19 years ago. So, but across the country, there was a raise. All of us were like, whoa. So we, we think that there's a lot of different reasons for that in this world right now. So it is possible that we wouldn't necessarily have 600 all the time, but definitely 3 to 4 is not uncommon.
What's the best part of your job?
As a speech pathologist, oh my goodness, the joy you bring to families, right? I mean, you've got families who are, I work mostly with kids. So in my experience, you've got families who their kids can't talk. They can't even ask for like another cookie, right? And then you're like playing with them and you're working with them and they start talking. It's just so exciting for the family until they start saying more for everything or why for everything. And they're like, no. So really you help more than the obvious, because if a child, person at any age is not effective at communicating, it's going to affect lots of aspects of their life and all the people around them, right? So like with hearing, there's a saying like, I can't remember what it is, I don't remember what it is, like lose something, lose your money and you lose whatever, lose your hearing and you lose your friends, right? Because they're tired of, if you haven't really taken good, you haven't gone to an audiologist and gotten a good hearing aid or whatever, they're like, I have to repeat everything. She says what all the time, like she's never hearing. It gets annoying to people, right? And so if you're going to help them with their hearing and help them learn to take care of their hearing aids and all those kinds of things, you're affecting more than just that person.
Makes a lot of sense. What would you say is your biggest challenge?
The biggest challenge is the fact that there are so many things that you could address, right? And so, but there are great resources, including other speech language pathologists, other professionals. So, you get disorders you've never heard of, just in terms of like maybe a genetic disorder that you've never heard of, or you get just a whole new thing that's been discovered in the speech language pathology world that, hey, here's something that's happening in the brains of these kids that we can do this with. So you have to learn that, right? So that's the most challenging, but again, it keeps things fresh and new, but it's definitely a challenge.
All right, Shannon, do you have any other questions for Joni?
So my one is just, so the cost for the program is just ISU's tuition, right? Or are there costs that occur above that?
We do have, in undergrad, we do have some course fees. They're not on every course. So if there's something that incurs a cost to our program to offer that course, like if, they have to have, access to this, whatever. And so, or they go down in the clinic and they're tearing out, score sheets off these speech tests or whatever. It's like we have to be able to replace those. So we charge, right, a course fee for something that costs the department to have the course. And then there are professional fees attached to every class at the graduate level. And that varies too. It's all posted online though. Each year it's all updated. And then the expensive is the online program, because you have the tuition, you have the course fee, and you have the online fees. So that's the most expensive route.
All right, I'm going to pause the